Hello, everyone, and welcome to our question lab. Hope everybody is having a good start to their week and staying safe. Today, we will be covering biochemistry. Before we begin, I want to introduce you guys to some people. First and foremost, I want to introduce you to Dr. Porphyria, who will be leading today's dissection. Dr. Porphyria.
Hey everyone, thank you, Sean. So I am currently a dermatology resident at UT Southwestern in Dallas, Texas. Originally graduated from pharmacy school and then graduated from medical school after that. I've been with RX as an RX coach specifically for a little under a year now, and I've been working with various students primarily on step one. And we'll kind of go through a bit of our question dissection techniques later today.
Excellent. And if you guys notice, there is a question box on the GoToWebinar panel, and that's where you can ask our panelists questions. And we have some wonderful panelists for you here today. First and foremost, we have Mark Heslin. Mark, if you want to introduce yourself.
Hello, everyone. My name is Mark. I'm a third-year medical student at Cooper Medical School of Rowan University. I've been an RX coach for about the past 6 months, and I'm excited to answer any of your guys' questions.
Wonderful, and I know we've used the word RX coach and the term RX coach a couple of times already. RX coach is our new tutoring program, and we're going to use that methodology today as we dissect questions. We have two additional panelists, Jeff and Kate, who are also there and willing to answer your questions. So feel free to type your questions into that box, and our panelists will do their best to answer all of those for you. So once again, RX coach is our new one-on-one tutoring program. From the team that brought you first day in USMLE-Rx. We'll talk about this more a little bit later, but without any further ado, I do want to get to know you guys since you guys have met me. My name is Sean. I've been with RX Coach for a little over a year and a half, and we've tutored several hundred students and done well over 1,000 sessions and had some really great results. One of our students just actually had an assessment over at 260, so we're really excited for her to take her test tomorrow. Now that you guys have met us, I want to give you guys a chance to kind of introduce yourselves via a question. So I'm going to launch a poll here and see what exams are you guys currently preparing for. Keep in mind that this poll you will continue to see throughout. We'll have 4 of these after this, and this is where you will answer the questions that we're doing together so we can see how all of you guys are doing and retaining and applying the information that we're covering today. We'll give you guys a couple more seconds to respond here, and then we'll get started. So feel free to pick one of these and let us know what you're studying for so we can keep that in mind as we plan out future question labs and work on future resources that you guys can use to your benefit. Excellent. Looks like about 2/3 of you guys have answered. So let's see who we have today. Looks like about 94% of our crowd is studying for step 1. We've got some COMLEX students, some CBSA students, some step 2 students, as well as students studying for their school exams. So hopefully all of you guys will benefit from today's session, and we look forward to answering your questions. Keep in mind that we do these question labs every week, Tuesday at 6 p.m. Eastern time. Next week, our subject will be oncology, and tomorrow we'll be doing a webinar called Secrets of the USMLE with Dr. Towley and Dr. Porphyria, and the topic for that will be endocrine. So make sure you guys take a look and try to join us if you can. We'll talk more about that later as well. So without any further ado, let's get going with our first question. Now, as I stated already, we use the methodology that we use in RX Coach, and I see some of our RX Coach students out there joining us today. So welcome, guys. You know who you are. And they'll tell you that the first thing we do is cover up our answer choices. And the reason we do that is because we do not want our answer choices to dictate our thought process, to guide our thinking, and we don't want students to see an answer choice that they are not familiar with, and that causes them to panic and throws them off of their A game. So as you can see, the answer choices have already been covered up and removed. So after that, we will then read the last sentence or the lead-in question, and I'll do that now. Which of the following is the function of the metabolic enzyme deficient in this patient? And after we read that last sentence, we want to think about how many steps this question will take for us to answer correctly. So an example of a one-step question is a question that asks us for a diagnosis. An example of a two-step question could be a question where they ask us, hey, what is the treatment for that diagnosis? And a 3-step question could be where they ask you, what is the mechanism of action for the treatment for that diagnosis? So with that in mind, I want you guys to think for a second to yourselves, how many steps do you think this question will require for us to answer correctly? After we do that, we will read the question stem together. And in our coaching sessions, our coaches will stop you after every sentence to make sure your thought process is on the right track. They'll ask you, hey, what are you thinking? What do you want to highlight? What's important? Why is this clue important? Why didn't you highlight this? What are you thinking? And we'll do that out loud so we can start to see your thought process, see how you're thinking, and identify any patterns that may exist so we can maximize your potential on test day. Since we don't have the time to do that today with all of you individually, I will pause briefly after each sentence to give you guys a second to collect your thoughts. So with that being said, let's read the question stem. A 2-year-old boy is brought to his pediatrician because of progressive failure to thrive. He has not been gaining weight appropriately and is currently in the 5th percentile for height and 10th for weight. His parents are also concerned because he is only able to say 1 to 2 words and does not know how to use a fork or a spoon. He is unable to walk without holding on to something. On physical examination, the spleen is palpable and the liver spans 12 centimeters. An image of the fundus is shown. Results of a bone marrow biopsy specimen show lipid-laden macrophages with a foamy appearance. And you see an image there. I'll give you guys a second to take a look at that. And then we will read the question again. Which of the following is the function of the metabolic enzyme deficient in this patient? And with that, I will turn it over to Dr. Beccaria.
Thank you, Sean. So I'll go ahead and read through the answer choices. Like Sean mentioned, we do like to start at the very bottom and work our way up. So let's start with answer choice E, and then we'll work our way up to answer choice A. And the reason we do that is we want to make sure that we're looking at all of the answer choices, that we're not biasing ourselves or becoming distracted by something that we see quickly. So this way we ensure that we get through all of the answer choices. So let's start with E. Converts sphingomyelin to ceramide. D. Converts glucocerebroside to ceramide. C. Converts ganglioside M2 to ganglioside M3. B. Converts galactocerebroside to ceramide. And A. Converts ceramide trihexoside to lactosyl cerebroside. And then we'll give everyone a second to gather your thoughts, come up with an answer choice. Sean's going to open up the poll here. Please go ahead and select the answer choice that you think is correct.
Excellent. So thank you, Dr. Beccaria. We have now the answer choices in front of you. Please take a minute to answer that question. If you don't know what the answer is, feel free to guess. Remember, even on the USMLE, there are no points deducted for guessing. So it's always good to never leave a question unanswered. So I'll give you guys a couple more seconds to answer this question. Hopefully we'll get it right, and then we will review not only why the correct answer is correct, but why the incorrect answers are in fact incorrect. So I'll give you guys another second, and then we'll take a look at the results together. It looks like a lot of you guys have answered. We're waiting on a couple more responses to trickle in. Feel free to take your best guess if you don't know what the answer is. Remember, it's okay to get questions wrong now. We're learning, we're studying. The goal is to make sure we know the material and how to apply it so we get it right on test day. Excellent. Looks like about 70% of you guys have voted, so let's take a look. Looks like 47% of you guys chose answer choice E, and 20% of you guys chose answer choice D. So let's see what the correct answer is. The correct answer is E, converts sphingomyelin to ceramide. And with that, I will turn it back over to Dr. Beccaria.
Thank you, Sean. So like Sean mentioned, the correct answer choice is E, and the disease in question here is Niemann-Pick disease. The enzyme deficiency in this disease is sphingomyelinase. So in that regard, the substrate that is going to accumulate is sphingomyelin. The clinical findings you would see in a patient with Niemann-Pick disease is progressive neurodegeneration, an elevated liver and spleen, and then these lipid-laden or foamy macrophages that we'll talk about, and you can kind of see there in the picture as well. And most importantly as well, as we were given that fundoscopic image, you will see a cherry red spot on the macula. So we were given a lot of these clues in the question, so let's go back to that question. So this young child, as they said, did have an enlarged spleen and an enlarged liver. On top of that, he was not meeting his milestones in various manners, and they kind of touched on this throughout the questions. So that would be consistent with neurodegeneration. They also showed us a fundoscopic image which showed a cherry red spot on the macula. Now, we've talked about one, but can you name some conditions where you would see a cherry red spot? Sorry, a cherry red macular spot? We do have a question box. It's on the right-hand side of your screen. Go ahead and open up that question box. Post in there what you think are some other diseases where you could see a cherry red macular spot.
Excellent. We'll give you guys a second to type those responses into your question box there on the right side. Keep in mind it's the same place where you can ask questions to our wonderful panelists. Looks like we've got some wonderful responses coming in. We see some people saying Niemann-Pick disease, some people saying Tay-Sachs disease. So Dr. Vicaria.
Yep, thank you, Sean. Absolutely. Niemann-Pick disease, as well as Tay-Sachs disease, and as well as central retinal artery occlusion as well can lead to a cherry red macular spot. So like we had talked about, this patient likely has Niemann-Pick disease, which as we mentioned is due to a defect in sphingomyelinase, which leads to an accumulation of sphingomyelin, and that causes you to get those foamy or lipid-laden macrophages that they told us in that very last sentence. Now, why is it not any of the other answer choices? Now let's go through those really quickly. Answer choice D converts glucocerebroside to ceramide. This is the enzyme beta-glucocerebrosidase, and this enzyme is deficient in Gaucher's disease. So while patients with Gaucher's disease may have hepatosplenomegaly like our patient, other features of that disease are not seen in our patient. So skeletal weakness, fractures, pancytopenia. On top of that, you would not have a cherry red macular spot with Gaucher's disease, and we also are not talking about Gaucher cells with the bone marrow biopsy, which as they describe it is more like a crumpled tissue paper look than a foamy look. So a couple of reasons why answer choice D is incorrect. Answer choice C. The enzyme hexosaminidase A is what converts ganglioside M2 to M3. And this enzyme is deficient in Tay-Sachs disease. So in this, you do get progressive neurodegeneration, like in our patient, and you also may have, or you do have the cherry red macular spot like this patient, but there are some other things with Tay-Sachs that we did not see in this patient. So children may become blind, deaf, unable to swallow. Those were not things that we saw here. And mainly, the main differentiating factor between Tay-Sachs and Niemann-Pick disease is Tay-Sachs would not have hepatosplenomegaly. That is the key characteristic differentiating factor that makes this Niemann-Pick disease. Answer choice B, the enzyme galactocerebrosidase converts galactocerebroside to ceramide. This enzyme is deficient in Crab disease. So infants with Crab disease develop optic atrophy, peripheral neuropathy, developmental delays, which we are seeing in this patient. However, we are not seeing optic atrophy on that fundoscopic image. Nothing in the question stem told us about any peripheral neuropathy. And then Crab disease would also not explain this patient's hepatosplenomegaly, making this diagnosis less likely. And lastly, answer choice A, the enzyme alpha-galactosidase A converts ceramide trihexoside to lactosyl cerebroside, and this enzyme is deficient in Fabry's disease. Here you would also see peripheral neuropathy, but you would also get some cutaneous manifestations with angiokeratomas, hypohidrosis, and then later on they can develop kidney disease and cardiovascular disease. The symptoms of our patient, which included hepatosplenomegaly, neurodegeneration, are not typical for Fabry's disease, and we also didn't see any of the manifestations of Fabry disease in our patient, so this answer choice is also incorrect as well. So the take-home point here is that these sphingolipidoses are very high yield for step 1, as Sean mentioned. It's important to know the characteristic features, how to differentiate between similar ones like Tay-Sachs and Niemann-Pick disease like we just talked about, the enzymatic defect and the substrate that is accumulating, and any high yield images. So any images of macrophages or fundoscopic images, these are all very high yield for step 1.
Excellent. So we got our first question, and now we're going to move on to question 2. Now I know that we had some people that got that question wrong, and that's okay. Remember, our goal is to get it right on test day and Niemann-Pick, and these diseases are definitely high yield, like Dr. Beccaria mentioned. So make sure you review those. And let's move on to question 2. Once again, for those of you guys just joining us, you will see that the answer choices are covered up. That is by design, and that is because we do not want you to be guided by, we don't want your thought process to be guided by the answer choices. We don't want it to dictate your thinking, and we don't want you to see an answer choice that you're not familiar with and that causes you to panic as you're reading the question. So we've covered those up, and then we will read the last sentence out loud together, or the lead in, and that is, which of the following defects is associated with this patient's most likely condition? Okay, so with that in mind, we will read the question stem together. An 18-month-old African-American boy is brought to the pediatrician because of failure to thrive and developmental delay. The infant is small, with coarse facial features and corneal clouding and an enlarged liver. He also has limited mobility in both his elbows and knees. Findings from cardiac and respiratory examinations are unremarkable. Clinical molecular biologists are consulted to determine the patient's suspected biochemical disease. Fibroblasts cultured from the patient are found to have deficiencies in specific lysosomal enzymes with corresponding elevations in the patient's bloodstream. Blood and urine testing, including for mucopolysaccharides, are unremarkable. On electron microscopy, the fibroblasts show prominent vacuolization and inclusions in the cytoplasm. So once we've read that, we will read the lead in and the question one more time. Which of the following defects is associated with this patient's most likely condition? And with that, I will turn it over to Dr. Beccaria.
Thank you, Sean. Once again, we will go through the answer choices, working our way from the bottom to the top. Answer choice E, defect in the metabolism of an essential amino acid. D, defect in the breakdown of sphingomyelin. C, defect in the breakdown of glycosaminoglycans. B, defect in the breakdown of glycogen. And lastly, A, defect in protein tagging at the Golgi complex. So we'll go ahead and give everyone a second to gather your thoughts. Sean is going to open up the poll. Please go ahead and select the answer choice that you think is correct, and we'll talk about it in just a second.
Excellent. So we'll give you a second to select the answer which you believe is correct. I see a lot of you guys are already on the right track. Once again, this is a very high yield topic. You'll definitely come across it in an exam at some point, whether it's in medical school or one of your board exams. So make sure you review this no matter what. We'll unveil the correct answer momentarily, just waiting for some of you guys to select your answer. Keep in mind that at the end of tonight's question lab, we will be doing a raffle and giving away some free stuff. So make sure you stick around to the end. You have to be present to win. And then we will also go over some commonly asked questions that we're seeing trends of in that question box. So stick around until the end, and we will give away some stuff and answer your questions. All right, let's see how you guys did. Looks like 49% of you guys selected answer choice A, defect in protein tagging at the Golgi complex. And then second place was answer choice C, with 29% of you guys picking a defect in the breakdown of glycosaminoglycans. So let's see what the correct answer is. The correct answer is A, defect in protein tagging at the Golgi complex. And with that, I will turn it over to Dr. Beccaria.
Thank you, Sean. So this question stem told us a few things about our 18-month-old boy. They told us that he has essentially failure to thrive, coarse facial features, corneal clouding, and hepatomegaly, or an enlarged liver. They also told us that his fibroblast cells are deficient in a lysosomal enzyme. These findings are all consistent with I-cell disease. I-cell disease is a lysosomal storage disorder caused by a deficiency in the enzyme N-acetylglucosamine 1-phosphotransferase. Once again, that's a long word, so I'll repeat it just again. N-acetylglucosamine 1-phosphotransferase. So this enzyme functions in the Golgi complex to tag lysosomal enzymes with mannose 6-phosphate. Once again, it functions to tag those enzymes, those lysosomal enzymes, with mannose 6-phosphate. This acts as a targeting signal for proteins to be sent to the lysosomes. So a deficiency of this enzyme would cause a defect in that tagging in the Golgi complex. And without this recognition tag, these lysosomal enzymes would not be directed to the lysosomes and instead are sent out into the extracellular space. Thus, you would then have excess amounts of these enzymes detected in the blood, which is what we saw here. And yeah, that's essentially it for I-cell disease. So let's talk about why the other answer choices are incorrect. So let's talk about answer choice E, defect in the metabolism of an essential amino acid. So there are a couple diseases like this, including PKU or phenylketonuria and maple syrup urine disease. These present with various signs and symptoms. For example, PKU presents with seizures, fair skin, eczema, while maple syrup urine disease presents with poor feeding and a distinct urine scent of maple syrup or burnt sugar. This patient does not have vomiting, does not have seizures, nothing about eczema or fair skin. And on top of that, they told us that the urine testing was unremarkable. Thus, the underlying pathophysiology is unlikely to be due to a defect in amino acid metabolism. Answer choice D, defect in the breakdown of sphingomyelin. Hopefully this sounds familiar, as this is characteristic of Niemann-Pick disease. Although patients with Niemann-Pick disease do have an enlarged liver like this patient and neurodeterioration, they also have numerous other findings that we just talked about, including endoscopic findings. And additionally, patients with Niemann-Pick disease do not have issues with their fibroblasts, like we had just reviewed. Thus, this answer choice is likely incorrect as well. Answer choice C, and I think this was our second place answer in the poll, a defect in the breakdown of glycosaminoglycans. These are classically seen in Hurler and Hunter syndromes. These are two lysosomal storage diseases that have presentations that are actually pretty similar to I-cell disease, with developmental delay, hepatomegaly. However, they cause an accumulation of mucopolysaccharides, specifically dermatan sulfate and heparin sulfate, respectively. However, in this question, they told us that there are no mucopolysaccharides detected. So a diagnosis of those lysosomal storage diseases is unlikely. And lastly, answer choice B, a defect in the breakdown of glycogen. These are typically seen in your various glycogen storage disorders. They predominantly affect the liver and muscle, and because of the absence of abnormalities in blood test results, a negative cardiac exam, nothing about muscle cramps, hypoglycemia, this patient is unlikely to have a defect in the breakdown of glycogen, making that answer choice incorrect as well. So the take-home point here is that there are a broad range of biochemical diseases, glycogen storage disorders, lysosomal storage disorders, defects in breakdown, metabolism. It is important to really know where these diseases are taking place at a cellular and even an organelle level to really understand how they lead to that clinical presentation that they're going to give us in the question style.
Excellent. Wonderful job, Dr. Porphyria. And good job to all of you guys out there. I know that, some of us missed it, but that's okay. Hopefully we'll learn from it. This is a high yield topic and you are likely to see it on an exam at some point. So make sure you're familiar with the material. And now let's move on to question 3. Now, before we do that, I do want to tell you guys a little bit about RX Coach. You guys have met Dr. Porphyria and Mark Heslin. two of our RX coaches. RX coaches are our new one-on-one tutoring program. It's designed for people who want to maximize their potential on test day and also study efficiently, because we have a lot of students who study very, very hard, but they don't see the results that they want. Remember, it's not only important to study and spend time, it's important to study the right things in the right order and make sure you've mastered that subject and are able to apply it before you move on. And we're here to give you that guidance and be that coach for you. So we start off with a 160 question assessment. Then we use that assessment to come up with a personalized study plan. It's a one-on-one approach because, as you guys know, everybody learns differently. We have different strengths and weaknesses. We think differently. We apply differently. So in order for you to really maximize your potential, you need somebody who can identify those areas for you and then maximize your potential by bridging those knowledge gaps and finessing your test-taking skills. All of our certified tutors are highly trained, and all of our packages include access to RX 360 and RX Bricks. Here's a testimonial from one of our students. With regards to my experience so far, it has been excellent. Dr. Titus is great at explaining concepts that I find complicated, and he does a great job guiding each session in a way that fills all the gaps in my knowledge for step one. Overall, I'm very glad to be a part of RX Coach. So if you guys are interested in RX Coach and would like to learn more about our one-on-one tutoring program, you can go to rx-coach.com. That's rx-coach.com to schedule a free consultation to discuss our tutoring program and how it can help you. If you want some generalized study tips and a free study planner, please visit firstaidteam.com. But if you're interested in our program and want to have a consultation to discuss it, please visit rx-coach.com. And the link for rx-coach.com is in your chat. And once again, a free consultation is to talk about our program and how it can benefit you. With that being said, let's move on to question number 3, and make sure you guys stick around till the very end so we can give away some free stuff, and hopefully one of you guys will be a lucky winner. Remember, you have to be present to win. So our third question. Once again, you will notice that the answer choices are missing and are covered up. That is by design. And now we will read the lead-in together. Which of the following enzymes is currently more active in maintaining this patient's glucose level? Which of the following enzymes is currently more active in maintaining this patient's glucose level? And with that in mind, we will read the question stem. A 45-year-old man comes to the clinic because of a 5-hour history of lethargy and a single episode of vomiting. He reports that he has not been eating well for the past 2 days because of a hectic work schedule. He takes no medication and has no significant medical history. His temperature is 36.7 Celsius or 98 degrees Fahrenheit. Pulse is 124 a minute, and respirations are 22 per minute. He is 177.8 centimeters or 5 feet 8 inches tall and weighs 77.1 kilograms or 170 pounds. His body mass index is 24, and laboratory studies show that renal function is within the reference range, and glucose concentration is 65. Which of the following enzymes is currently more active in maintaining this patient's glucose level? And with that, I will turn it over to Dr. Viccaria.
Thank you, Sean. So once again, we will start at the bottom. Answer choice E, pyruvate kinase. Answer choice D, phosphoglycerate kinase. C, phosphofructokinase 2. B, fructose bisphosphatase 2. And A, fructokinase. So once again, we'll give everyone a couple seconds to gather your thoughts. Sean's going to go ahead and open up that poll. Please go ahead and select the answer choice that you think is correct, and then we will talk about it more in just a second.
Excellent. So we've got question number 3. We've got one more left after this before our raffle. So take a second, select your answer. I can tell you guys are struggling a little bit with this one, but that's okay. We're here to learn, and we will do that together. So if you do not know what the answer is, feel free to pick one that you think is correct. Remember, there are no points taken away for guessing. So we'll give you guys another second to select your correct answer choice. Looks like we've got a tie so far with 2 answer choices. Let's see if one of them pulls ahead. Give you guys a couple more seconds. Excellent. So it looks like about 2/3 of you guys have answered. I'm going to go ahead and show you guys how we all did together. Looks like first place with 33% is B, fructose bisphosphatase 2, and answer choice C is a close second with phosphofructokinase 2. And let's see what the correct answer is. The correct answer is B, fructose bisphosphatase 2. So a challenging question. You know, about 1/3 of us got it right. That's a good start, and hopefully by the end of this session, we'll be able to say 100% of the people will get it right on test day. So Dr. Viccaria.
Thank you, Sean. So this patient is a 45-year-old man. They told us that he has an acute onset of lethargy and vomiting, and he is stressed and has not been eating well for a couple days. They told us that his glucose is low. I'm not sure if we can pull up that slide. But based on these findings, the most likely diagnosis is that he has mild hypoglycemia. So in the fasting state, and we would consider him to be in a sort of fasting state because he hasn't been eating well for the last 2 days, glucagon and epinephrine are stimulated, and they're stimulating the beta receptors. So beta receptors stimulate the GS pathway. Can you guys tell me what would then get increased as a result of GS stimulation?
Feel free to put your answers and your responses into the question box, and we'll give you guys a second to type up those responses in there, and then we will see how you guys did and continue the explanations. Looks like a lot of you guys have some good answer choices. Cyclic AMP seems to be on the list. Protein kinase A.
Yep, absolutely. Those are the two things that would be increased via the GS pathway. So you would have increased CAMP, which would result in increased protein kinase A. So protein kinase A stimulates fructose bisphosphatase 2, and that would be the correct answer in this question. So protein kinase A stimulates fructose bisphosphatase 2 and also inhibits phosphofructokinase 2. So once again, protein kinase A stimulates fructose bisphosphatase 2 and inhibits phosphofructokinase 2. Both of these lead to a decrease in fructose 2,6-bisphosphate, and that is responsible for elevated expression of phosphofructokinase 1, which is the enzyme of glycolysis. So the end result is a decreased expression of phosphofructokinase 1, which is the enzyme of glycolysis, which is good. In this case, we don't want to break down glucose when we are in that fasting state. So let's take a look at the other answer choices and why those are incorrect. Answer choice E, pyruvate kinase. This is an enzyme of glycolysis and would be most active in the fed state. Keep in mind that they told us that he hasn't been eating well, and this is more of a fasting state. Answer choice D, phosphoglycerate kinase. This is active in both fasting and fed states and isn't more active in the fasting state that this patient is currently in. So this is likely an incorrect answer as well. Answer choice C, phosphofructokinase 2. This is increased as well in a fed state. In the fed state, insulin leads to a decrease in CAMP, and that is responsible for increasing PFK2 in a fed state. As we just talked about, in this fasting state, PFK2 would be inhibited by protein kinase A, so this is likely an incorrect answer. We just talked about how answer choice B is a correct answer, and so let's talk about answer choice A, fructokinase. The activity of fructokinase is at a maximum after eating a meal that is high in, you guessed it, fructose. This enzyme is not involved in glucose metabolism and is thus not a correct answer choice for this question. So the take-home point from this is that during fasting, both glucagon and epinephrine levels are increased. They act via the GS pathway, which leads to an increase in CAMP and then protein kinase A. This in turn increases fructose 2,6-bisphosphate levels and decreases the PFK2 level, which as a net result decreases the breakdown of glucose.
Excellent. So good job, guys. I know it was a challenging question, but that's okay. Once again, we want to challenge you guys a little bit to think. We can review this material together. So with that being said, let's move on to our last question. Once again, make sure you stick around to the very end because two of you lucky students will receive prizes from our raffle. So make sure you stick around for that. So our last question of the evening. Once again, you will notice that our answer choices are covered up, and we'll read the lead in together. In which cellular compartment is the defective enzyme most likely located? And now we will read the question stem. A 50-year-old man comes to his primary care physician because of chronic blistering, itchy skin over his forearms. Laboratory records show that the patient has a long-standing history of mild elevation of transaminases in the blood. The patient reports that his urine is tea-colored. On examination, there are small, tense vesicles, bulli, and erosions over the dorsal aspect of both forearms and hands. In which cellular compartment is the defective enzyme most likely located? Dr. Beccaria.
Thank you, Sean. Once again, we will start with the answer choices from the bottom and work our way to the top. Answer choice E, the rough endoplasmic reticulum. D, the nucleus. C, mitochondria only. B, mitochondria and cytoplasm. And A, cytoplasm. So once again, we'll give everyone a second to gather your thoughts. Sean's going to open up that poll. Please go ahead and select the answer choice that you think is correct, and we will talk about it again in just a second.
Excellent. So, they love to ask you where these enzymes are located. They're easy points on the exam. So you have to figure out, what's going on, what the enzyme is, and where it's located. And so we're going to review where these enzymes are located here when we review the correct answer. So we'll give you guys a second to select the answer which you believe is correct. Once again, if you don't know what the answer is, take your best guess. It looks like a lot of you guys are on the right track. So far we're doing pretty well with this question. We'll give you guys a couple more seconds, and then we will review the correct and incorrect answers, because remember, it's important that every time we do a question, like we do in our coaching sessions, we want you to think out loud and explain why you're selecting the answer you're selecting and why you're not selecting the answers that you're not selecting. And then we also want our students to be able to explain why the correct answer is correct and why the incorrect answer is incorrect. There's a lot we can learn from every single question. And as we do that, as we start to see your patterns and your thought process, we can bridge those knowledge gaps and fix those test-taking deficiencies to really give you that edge on testing. We have one of our students taking her test tomorrow. I want to wish her good luck if she's here today. She broke a 260 on her assessment twice in a row, I believe. And so we wish you all the best tomorrow, and we thank you for being a part of our program. All right, looks like 80% of you guys have voted, so let's share these results and see how you did. Looks like 37% of you guys picked answer choice A, which is cytoplasm, and then runner-up was rough endoplasmic reticulum with 22% of you guys selecting that. So let's see what the correct answer is. And the correct answer is A, cytoplasm. And with that, I will turn it over to Dr. Beccaria.
Thank you, Sean. So Sean has pulled up here the enzyme locations of all the enzymes that are involved in this pathway. And you can see here how the intermediates travel from the mitochondria into the cytoplasm and then back out into the mitochondria. So the enzyme that is specific to this disease, or Porphyria cutanea tarda, is uroporphyrinogen decarboxylase, also lovingly referred to as UROD, and that occurs in the cytoplasm. So let's take a look at this patient again. So this is a 50-year-old man with chronic skin blistering, tea-colored urine, and elevated transaminases. he most likely has what we just talked about, PCT, or Porphyria cutanea tarda. It is caused by defects in that enzyme, that URAD enzyme. Do you all know what part of your body you would develop these blisters? Feel free to post in the question box below, or on the right side of your screen, I'm sorry, where you think patients with PCT would develop blisters on their body.
Excellent. We'll give you guys a second to respond here, and let's see what you guys come up with. So far, we're seeing forearms and skin, sun-exposed areas, hands. So it looks like you guys are on the right track. And with that, I'll turn it back over to Dr. Beccaria.
Thank you, Sean. Absolutely. Sun-exposed areas are where you would develop those blistering skin lesions, most prominently the dorsal hands. So URAD, or uroporphyrinogen decarboxylase, is involved in the heme synthesis pathway. When you have a decreased activity in this enzyme, you get accumulation of uroporphyrins, and that causes the tea-colored urine, the blistering skin lesions on photosensitive areas. Now, as we just showed in that picture, different steps of the heme synthesis pathway occur in the mitochondria or the cytoplasm. And it's important to know not just the steps and the intermediates, but where in the cell this is occurring. And if you're sensing a theme here, knowing where in the cell, where in the organelle it is occurring is a very high yield thing to know. So the mitochondria are involved in the first and the final steps of the pathway. In this step, the defective enzyme URAD is in the cytoplasm. Thus, the other answer choices of rough endoplasmic reticulum, nucleus are incorrect. It is not the mitochondria only. It is not the mitochondria and the cytoplasm. In this disease of PCT, it would just be the cytoplasm. Answer choice A. So the take-home point, again, is that it's important to know a lot of these locations of where these defects are occurring. What is the substrate that is accumulating? What is the substrate that is not being formed? What is the enzyme? And obviously what the diseases are that are associated with that and how they present phenotypically.